Jason, how are you going today?
Good.
Good? Excellent. So today we're going to be doing some assessments for the competency standard HLT AID 003 Provide First Aid that you recently finished your training in.
Mm-hmm.
So we're going to run through a couple of assessments today. The first one that we'll look at is where I'll be asking you some verbal questions and you'll just respond verbally to those.
Okay.
And then we'll be doing a scenario where I'll be observing you performing a first aid task.
Mm-hmm.
Yep, great. Have you done some assessments like this before?
Yes.
Yep, so basically we're doing what's called competency-based assessment. So you'll either be checked off as having completed it satisfactorily or not satisfactorily. And if for some reason you weren't able to achieve satisfactory today, you would get another opportunity to complete the assessment. Do you have any questions so far?
Nope.
Nope. So basically with the first part of the assessment where I'll be asking you some questions, it shouldn't take any longer than about 5 minutes or so.
Okay.
And then when we do the second part with the observation, I wouldn't expect it to take any longer than 10 minutes or so. And do you require any specific support needs, like to help you with your assessment today? Anything
No.
particular? No. Okay. And you have the right to appeal any decisions that we make today. Say if you disagree with the decision in the end, you have the
Do
right.
I?
Yep.
I didn't know that.
Yeah, you do. Good. Any other questions about the assessment process today?
Nope.
Nope. You can stop me along the way if you have any questions or if something's not quite clear. After we've run through the assessment, I'll give you a decision on whether you've completed it satisfactorily or not satisfactorily. And you also have the opportunity to provide me with some feedback at the end of the session today. Okay, thank you. So we might get started. So as I said today, we're starting off with some verbal questioning. So I'll ask you 5 questions and I'm going to record your responses on my form here, and then I'll give you the result of your assessment at the end.
Okay.
So question 1, what is the acronym for first aid and what do each of the letters stand for?
Doctors A, B, C, D. Danger, response, send for help, airways, breathing, CPR, and D, fib.
Mm-hmm. So, second question. Do people have the right to refuse first aid treatment, and how would you know if they agreed to the treatment or not?
Yes, they have the right to not want the treatment, and they can tell you they don't want the treatment when you ask them.
Yep. Okay. So, question 3. You're having lunch at work and suddenly one of your colleagues is coughing and gagging. What would you do?
You would encourage coughing.
Yep.
Mm-hmm.
Okay. So, question 4. You're in the tea room at work and you notice that the person next to you is wheezing and having breathing difficulties and is trying to administer their asthma inhaler. And what would you do?
You can ask them if they want help or with the administering the asthma, or help them with the asthma.
Mm-hmm.
By if they had a spacer, you could help them put the Ventolin in the spacer.
Yep. Excellent. So, question 5, which is our last question. Your friend was making you dinner and they accidentally sliced the palm of their hand whilst chopping some vegetables. What would you do?
You do the normal doctors A, B, C, D, and you clean the wound and apply the dressing.
Yep. Probably should have said at the beginning to turn your phone off or put it on silent. But anyway, you might want to do that now. Alright, so that brings us to the end of the first part of assessment for today. And you've actually answered all the questions satisfactorily, so you get a satisfactory mark for that assessment task.
Mm-hmm.
So, do you feel ready to move on to the next section where I'll be observing you providing first aid in a scenario?
Mm-hmm.
Yep. So, for this scenario, you will be providing first aid for someone who's burned their left arm whilst heating their lunch in the oven in the kitchenette in your workplace. And in order to be marked satisfactorily, there's some techniques that you would have learnt in your training for burns first aid that I'll need to check you off on.
Okay.
Yep. So we've got some first aid equipment here that you might need. We've got a first aid kit, and we're in the kitchen, so there's all sorts of different things that you could use if you needed to. So because it's only me and you here, we can just pretend that I'm the one with the burn. And what would you do in that scenario?
This scenario.
Just that section there.
Burn their left arm whilst heating their lunch in the oven in the kitchenette in your workplace. You do the doctor's ABCD.
Mm-hmm.
And don't put a fabric dressing on it because it might stick to the dressing. You can put a non-stick dressing like cling wrap on it, and running water, cool running water,
Mm-hmm.
or some sort of cool pack.
So I guess I've just burned my arm, and you're doing your doctor's ABCD. Could you give me a bit more detail about what that would mean in that scenario if I burnt my arm?
Well, yeah. Check for danger, make sure that you're not going to get burned.
Mm-hmm.
Ask the person if they want to look at the burn.
Mm-hmm.
If they can't respond, then you help them anyway.
Yeah.
If you need more help, you can send for help. Ask someone else to send for help, or call an ambulance now. If they have a collapse unconscious, you can, but they're not going to the burn.
No.
We'll move on.
Yeah, I guess if it was just like a superficial burn that I sustained in the oven, you've checked for danger, and I've agreed to receive treatment for this burn. So now what do we do next? My arm's a bit sore.
You want me to put the stuff on your arm?
Yes, please. It feels a bit hot actually. A bit burnies.
Put that in?
Yeah. Well, you're putting blood wrap on me.
So it doesn't get infected.
Ah. Cool.
It'll stop other stuff getting on the wound.
Mm-hmm. Excellent.
And try not to touch it.
Okay. Cool.
And then I'll move you over here. And we'll just do that until it doesn't hurt anymore.
Okay.
And then probably pretty good with that one.
Mm-hmm. Perfect.
And then you can see how you're doing later.
Yeah.
I'll ask if you need support.
Mm-hmm.
Mental problems.
Yep. Guess that's important.
If it's in the workplace, you have to tell HR about it and fill out the correct forms.
Mm-hmm.
And possibly I'll need counselling or something myself.
Depends. It might have been traumatic
If it
experience.
was traumatic.
Yeah.
The superficial burn on your arm.
Yep. A rip.
Clean wrap thing.
traumatic, wasn't it? Okay. So I might just run through my checklist here. So yeah, so far so good. So I've actually marked you off, and you've ticked off all the boxes in my criteria, and you've been marked satisfactory for that assessment task. Congratulations.
Excellent.
So I think you did pretty well in that section. I guess with the feedback, I guess with any observation, I need to see a bit more detail, like you're talking through the scene rather than just doing, like quite a bit more feedback on the DRS ABCD stuff.
Okay.
But it's good that you kind of knew that acronym, but you to see you applying it, but you ended up getting there, so that's great. So that means that you've been marked satisfactory in those two assessment tasks within the competency standard HLT ARD 003, provide first aid. There are a couple more assessment tasks that you'll need to complete to be marked competent in that unit. So one of them's a written test, and then you'll have to do a couple more direct observation assessments where you'll have to provide CPR to a adult mannequin,
Yep.
and the infant mannequin, and I'll need to observe that and do exactly what we did just then and mark you off satisfactory or not satisfactory for those other 3 assessment tasks as well. Excellent. So I'll get you to fill out this feedback form for me if that's okay. Just see if there's anything that we could improve on for that assessment task. Thank you.
Documents clear and helpful. I didn't really even look at the documents, so